Dear learners, now we will learn about global and regional health challenges. In this module, you will know how global and regional level different challenges for health and well-being. Myself, Dr. Netran Sahu, Department of Geography, Delhi School of Economics, University of Delhi. Let's start. Learners' outcome from the discussion on global and regional health related challenges, how to understand global health challenges. So, gain in comprehensive understanding of the major global health challenges, learners will gain including non-communicable disease, communicable disease and emerging threats for example pandemic and also different types of antimicrobial resistance. So, then learners will analyze regional wise health issues, explore the specific health challenges across different regions of India, focusing on issues like malnutrition, infectious disease and disparities in healthcare access between rural and urban areas, examine the impact of socio-economic factors on health, understand how socio-economic factors such as poverty, education and infrastructure influence health outcomes both globally and within India's diverse regions. Then learners will know, assess the role of environmental and lifestyle factors, for example identify the role of environmental factors such as climate change and pollutions as well as lifestyle related issues like diet and physical inactivity and also in controlling the global and regional health burdens. With these also learners will learn different organizations provide varying definitions of health challenges reflecting their perspective on global health issues. Here are some definitions by key institutions. Let us have WHO, World Health Organizations, how WHO defines health challenges as complex health issues that require coordinated actions and long-term sustainable solutions. These challenges include a wide array of issues such as non-communicable disease, infectious disease, mental health and health inequities, or also only economic factors. For example, there are other factors with economic factors, socio-economic factors and climate change. Then also focus on World Health Organization focus on global health aiming to improve health equity by addressing both disease and specific challenges like HIV and AIDS or tuberculosis and also broader systematic issue like access to health care, sanitation and environmental health. Then for Centers for Disease Control and Prevention, for example, what are the definitions? Center for Disease Control Prevention defines health challenges as significant barriers to the health of populations stemming for factors like chronic disease, infectious disease outbreaks and environmental hazards and behavioral factors. Then chronic health disease or emphasize the importance of prevention and preparedness in addressing these challenges in different parts of the regional and global level. So, focus CDC's focus is on largely on public health threats and preventive health measures including vaccination, disease surveillance and lifestyle related risk factors for chronic disease, for example smoking, obesity. Then we have United Nations, United Nations also define the United Nations particularly through its Sustainable Development Goals SDG 3 identifies health challenges as the barriers of achieving good health and well-being for all. This includes addressing universal healthcare access, reducing maternal and child mortality, combating disease and promoting mental health and well-being. Then what are the focus? The United Nations approach is to broaden the integrated health challenges into global development goals and to emphasize the holistic view of health as it related to other factors like poverty, inequality and climate change. For example, United Nations link this with other factors, climate change and environmental health also. World Bank definition, the World Bank describes health challenges as the structural and financial barriers to achieving equitable healthcare access and outcomes. These challenges include inadequate healthcare infrastructure, financial barriers to healthcare access and the burden of disease in low and middle income countries. Now, what are the focus? The World Bank focus on the economic aspects of the health challenges, particularly how they impact developing nations, and it highlights the importance of investing in healthcare systems and infrastructure to improve outcomes. Then we have like global health councils, for example, like they have also definitions for health challenges. So global health councils refers to health challenges as interconnected health issues that require global collaborations and sustainable solutions. The council emphasizes the relationship like interrelationships between health, human rights and socio-economic factors. Then focuses, like what are the focus? It focuses on fostering international collaborations to address both communicable and non-communicable disease, health equities and the strengthening of the healthcare systems. Each organization recognizes that health challenges and are multifaceted and deeply interconnected with other socio-economic and environmental factors. This is clear from all these definitions. The common thread is the call for collaborations, then sustained actions and systematic improvements to tackle these issues comprehensively. For example, global health statistics, global life expectancy trends have evolved significantly over the past decades due to advance in healthcare, sanitation and socio-economic conditions. Then what are the historical trends? Early 20th century, like global life expectancy in the early 19th century at the beginning of the 20th century was quite low, averaging around 30 to 40 years, largely due to the infant mortality rate, infectious disease and lack of healthcare facilities. But post World War II improvements, like from 1950s to 1970s, after World War II, life expectancy rose steadily due to better medical advancements, for example vaccines, antibiotics and improved nutrition and public health measures. In 50s, global life expectancy was around 47 years. Late 20th century, 1980s and 2000, by the turn of the 21st century, life expectancy has increased significantly, with global average reaching around 67 years due to further healthcare improvements, reduction in child mortality and better control of infectious disease. So, current global trends like 2020s global average life expectancy in 2021, according to the WHO World Health Organization, global life expectancy in 2021 was about 73 years. However, there are stark regional variations due to factors such as healthcare access, poverty and conflict. Gender disparities. Women tend to live longer than men globally. The average life expectancy for women is approximately 75.6 years, while men it is around 70.8 years only. This is biologically. So, that is inborn. Like impact of non-communicable disease in many countries, particularly high income nations, new communicable disease like non-communicable disease like heart disease, cancers and diabetes are now leading cause of death, influencing life expectancy trends. Then regional variations in life expectancy like high income countries, for example those Japan, Switzerland country like Japan, Switzerland, Singapore exceeds 8 years, with Japan having one of the highest life expectancy average in global like at about 85 years. These countries benefit from advanced healthcare systems, lower maternal and child mortality and strong public health infrastructure. Low income countries, for example in sub-Saharan Africa, life expectancy is much lower, about 60 years. This is largely due to the ongoing challenge like HIV AIDS, malaria, high maternal mortality and poor access to the healthcare. So, Sierra Leone for example has one of the lowest life expectancy, around 54 years in the very low. Middle income countries like in emerging economies like India and Brazil, life expectancy is improving rapidly, but we have still lot of things to do to achieve at the on the developing level. Still lags behind high income countries in India, like for instance life expectancy around 70 years, while Brazil stands like we have also like 75 years. So, like impact of COVID-19 on life expectancy, like global decline like this COVID-19 pandemic led to temporary reduction in the life expectancy across the countries. For instance, the US saw a decline from 78.8 years in 2019 to 77 years in 2021, largely due to pandemic related deaths. So, these regional impacts like countries like India, Brazil and Russia experienced sharp decline in life expectancy due to pandemic, particularly from 20 to 21. So, key factors influencing this life expectancy. The healthcare access, for example, availability and quality of healthcare play a major role, like countries like universal healthcare trend to have higher life expectancy. Nutrition and sanitation, improve the nutrition and access to clean water, sanitation have contributed significantly to the rising life expectancy. So, then we have like many public health initiatives, for example, vaccination programs, disease prevention efforts, for example, malaria control and also maternal health programs also boost the life expectancy at different level of diversity in different region. Then we have socio-economic status, like higher income and educational level are stronger correlated with the longer lifespans. Then climate change and pollution, environmental factors like air pollution and climate change related disasters are increasingly affecting life expectancy, especially in developing regions. So, what are the future projections? Further increase in life expectancy is projected to continue rise globally, potentially reaching 77 years by 2050. However, these emerging challenges like aging population, non-communicable disease and climate change are factors which cannot be ruled out. Technology and healthcare advance like innovations in healthcare such as personalized medicines, artificial intelligence in diagnostics and improved like different types of healthcare vaccinations and life expectancy, particularly in middle income countries. In this figure, learners will see like the life expectancy of 1950s and 2000 and also like 2050 projections for like continent wise. So, like in this figure you can clearly see region wise how this different continent wise also like you have a major causes of death. Then let us like worldwide challenges. The major causes of death worldwide are diverse with significant differences between high income and low income countries. The leading causes of death can be categorized into non-communicable disease and communicable disease, injuries and other health related issues. For example, non-communicable disease, like non-communicable disease account for the majority of the global deaths, particularly in middle and high income countries. So, cardiovascular disease, for example, death toll like responsible for around 17.9 million deaths annually or 32% of the global death. And types like include heart disease and also you can have strokes and also hypertension related complications, and this is one of the major factors. Then what are the key risk factors like high blood pressure, high cholesterol, smoking, obesity, physical inactivity and poor like diet. In this figure, learners will see the top 10 countries where the cardiovascular death rates of the world, and they can realize like how the cardiovascular cases are also in the next figure also they will see the different types of causes of death. So, like cancer, for example, death toll around 10 million deaths annually happens, like common types like for example lungs cancer, leading the cause of cancer death, breast cancer, cholesterol problem, prostate cancers, risk factors smoking like poor diet and exercise, like for example genetic predispositions and also environmental pollutants. Then we have chronic respiratory disease. Death toll around 4 million deaths annually. For example, common conditions like chronic obstructive pulmonary disease, asthma, occupational lung disease. Okay. What are the risk factors? Like tobacco smoke, air pollution, occupational exposures to chemical and dust, and then we have like diabetes. Then death toll like cause about 1.5 million deaths annually, with additional deaths linked to complications from diabetes, for example cardiovascular disease and also type 2 diabetes is the most common form of driven by the poor diet, physical inactivity and obesity. In this figure, learners can see the global variations types of cancer of deaths as in this figure 2018 has been covered. So, like communicable disease, maternal, neonatal and nutritional, like different types of nutritional conditions, and these are the leading causes of death in low income countries, particularly in sub-Saharan Africa and South Asia. So lower respiratory infections, then death toll like around 2.7 million deaths annually, including pneumonia and influenza. Affected regions like particularly high in low income regions due to poor access to the health care and vaccinations. So what are the key drivers like lack of sanitation, poor nutrition, inadequate vaccinations and air pollutions. So then we have also another disease like diarrhea. Death toll like responsible for around 15 million deaths each year, particularly among children under 5. What are the causes? Like contaminated water, poor hygiene, lack of sanitation and malnutrition. So in India also we have problems of malaria. Affected regions like most in the developing countries, sub-Saharan Africa and also South Asia, for example. And another disease, let us see, like tuberculosis for example. Death toll like kills around 1.5 million people annually. The key drivers like poverty, overcrowding and poor health systems exaggerates like its spread. What are the hotspots? South Asia, Sub-Saharan Africa, especially among immunocompromised populations like those with HIV and AIDS. Then we have like HIV and AIDS death, like disease having death toll like causes around 6,50,000 deaths annually. Regions like most focus region is Sub-Saharan Africa is the most affected regions. Prevention and treatment like significant progress has been made due to antiretroviral, for example you can say ART therapy, but it remains a major health burden also. Like malaria, like for example death toll kills around 6,20,000 people each year, primarily children under 5, and regions like concentrated in Sub-Saharan Africa though parts of South Asia and Latin America are also affected. For example, this Sub-Saharan Africa being the lower income group of people and lack of malnutrition that has serious impact on this type of disease. Then prevention use of insecticides like treated nets, indoor spraying and anti-malaria drugs have reduced mortality rates. Then another like neonatal conditions, for example death toll, around 2.4 million neonatal deaths each year, accounting for 47% under 5 children. So causes like premature birth, asphyxia, then infectious, then also infections and congenital anomalies. So regions like mostly in the low income countries due to poor maternal health services and inadequate care during childbirth. In this figure also learners can see that diarrhea is the second most cause of child deaths worldwide. So learners can see this figure and also they can analyze like how the death related to like this disease. So then we have like various injuries like both international and intentional and also unintentional along leading factors of death worldwide. Then we have also traffic injury like death toll around 1.3 million deaths annually. What are the key factors like speeding, driving under the influence of alcohol or drugs, distracted driving and lack of road safety infrastructures. So what are the regions those who are very affected because of this, like most common in low and middle income countries where road safety measures are less stringent. Then also self harm and suicide like death toll, for example approximately 700,000 deaths annually. Age group, it is the fourth leading cause of death among people aged 15 to 29. The regions are like high rates are observed in low and middle income countries with contributing factors like mental health issues and social isolations and economic distress. Then we have also violence and conflict. So then the death toll like includes death from interpersonal violence, homicides and also armed conflict, particularly in the war zones. Then the regions affected are like Sub-Saharan Africa, Central America and the Middle East. The emerging threats like new health threats are emerging with the potential to become significant cause of death. Then we have microbial resistance. Future impact like could result in an estimated 10 million deaths annually by 2050. if no action is taken. What are the key drivers? Like overuse of antibiotics, poor infection control, and also like late development or different types of pandemics. For example, COVID-19 pandemic 20 to present, like COVID-19 caused over 6 million deaths worldwide. So you see that how diverse, how the huge number of people died because of this pandemic. So then other potential pandemic like influenza, Ebola, and other zoonotic disease have the potential to cause a significant mortality across, like in the different countries and globally. Also malnutrition and hunger, like sub-Saharan Africa, for example, very malnutrition and hunger death. So death toll like cause around 3.1 million child deaths, and annually it making a leading cause for death among children under 5. What are the key drivers? Like lack of food security, poverty, and inadequate access to the health care exacerbates this malnutrition in low income regions. According to the World Health Organizations, 1 in 8 people, approximately 970 million people globally, live with a mental health conditions. So for example, depressions and anxiety disorders are the most common mental health conditions, contributing significantly to the global disease burden. So the common mental health disorder and their prevalence, like the following are the most preventive mental health disorders affecting millions worldwide. Number 1, depression. Global prevalence like affects approximately 280 million people globally, this depression, making it one of the leading causes of disability worldwide. Then regional difference, you can see higher prevalence in the regions like social unrest, economic instability, or low access to medical health care. For example, South Asia, Sub-Saharan Africa. Then impact are like depression can lead to suicide, with over 700,000 deaths annually attributed to suicide, which is the 4th leading cause of the death among young aged 15 to 29. Then anxiety disorders, global prevalence affects about 301 million people worldwide, including 58 million children and adolescents. You can see like anxiety disorder. So types of anxiety disorders like includes generalized anxiety disorder, social anxiety disorder, and also like panic disorder and phobias. So because of that also more adult are like young people are very stressed. So like for example exam anxiety, some people in India also we have cases of examination anxiety. So that also impact the those students are going for taking exams. So anxiety is significantly impairment in the daily functioning, relationships, and work productivity. In this figure, learners can see the percentage of people live with anxiety disorders. Then bipolar disorder, like global prevalence, for example, affects approximately 40 million people globally. So we have like nature like characterized by extreme mood swings, including episodes of mania and depressions. What are the impact? Like bipolar disorder is often associated with high rates of disability and can significantly affect personal and professional life. Then schizophrenia, like we have global prevalence, like affects about 24 million people worldwide, or 1 in 300 people. This schizophrenia like is a severe mental disorder characterized by distortions in the thinking perceptions like emotions, language, and behavior. In fact, it is one of the most debilitating mental health disorders leading to significantly long-term disability. And then we have post-traumatic stress disorder, like post-traumatic stress disorder. That means after any trauma, this disease is occurring, like it's changing the behavior. So affects like around 5% of the people globally at some point in their lives. Nature, like this post-traumatic disorders like is triggered by exposures to traumatized events such as war, natural disaster, accidents, and abuse. So regions with higher prevention, areas with conflict, natural disasters, and also high rates of violence. For example, conflict zones in Middle East, Sub-Saharan Africa, and South Asia having higher rates of post-traumatic disorder disease. So then eating disorder, for example, global prevalence affects around 16 million people worldwide with disorders such as anorexia, nervousness, bulimia, nervosia, and being a eating disorder. Like you can see what are the impact. Eating disorders are associated with significant physical health risk and high mortality rates due to malnutrition and suicide. Then substance use disorder, like global prevalence affects 164 million people worldwide, with alcohol use disorder being the most common, like 107 million, followed by drug use disorder like 57 million. So what are the impacts? Like substance use disorders often co-occur with other mental health conditions and lead to physical health problems. So like social issues and also increased risk of suicide. So then we have like source, like for example, like at the regional prevention centers, we can here learners can see like different types of sources has been given for them to understand like how to see, like for example mental health disorders. Mental health disorders prevalence varies widely across regions, influenced by factors like economic status, access to mental health services, cultural attitudes, and exposure to the conflict or trauma. Then for example high income countries, like prevalence mental health disorders are highly prevalent in high income countries. For example, you can see mental disorders cases are more due to better diagnosis and awareness also, like for example conditions, depressions, anxiety and substance use disorders are more common, often related to stress, lifestyle factors and high pressure environments. Like access to care, for example higher access to mental health care, but stigma and underfunding still prevent many from seeking help. Then low and middle income countries, for example prevalence mental health conditions are underdiagnosed but still prevalent, affecting millions, particularly in the regions like South Asia, Sub-Saharan Africa and Latin America. What are the barriers? Like stigma, lack of healthcare infrastructure and inadequate resource make it difficult for people to access treatment. So there, like you can see, like for example there is also a significant shortage of mental health professionals. How to diagnose? So impact of conflict and poverty. Countries experiencing war, conflict and economic instability such as Syria, Afghanistan and parts of Africa reported high rates of post-traumatized disorders, depressions and anxiety. Then post-COVID-19 mental health crisis, like the COVID-19 pandemic led to significant increase in mental health conditions globally. Depressions and anxiety rates rose by 25% in 2020 due to social isolations, fear of illness and economic hardships. So World Health Organization's Global Health Observatory, so for example what they are saying, like source with Global Health Organization 2021, like Global Health Observatory data repositories. So they are saying, like for example in this condition you can see what are the different types of global health data available. For example you can have a, like we have a Lancet also, like they are giving also how this pandemic issue are there. So here learners can learn like from this model that how this global prevalence of different types of disease at regional level and also at the different global level, and from stress, anxiety, stress, depression, all these factors and different areas, how malnutrition also impacts in Sub-Saharan Africa. So all these things I think learners had learned a lot of things from this model, and now you can see I have provided here many references and also many websites where you can see, like at the India level also global level. For example India level we have Niti Aayog, there is also data available, Ministry of Health Welfare available. So learners can also take these helps to learn something like how global and regional level these health challenges are there, different types of challenges. Thank you for listening.